This is Boomer Life on CL 650.
Welcome back to the program. Sterling Fox with you, along with Dr. Kimit Rai, the surgical director at FalseCreek Healthcare Center. We're talking cosmetic surgery on this episode of Boomer Life. Dr. Rai, we touched a little bit about on breast surgery, augmentation, that sort of thing, and then we moved into the area of anti-aging. But really, the whole matter of breast surgery is also part of that category too, isn't it?
That's correct, yes.
So talk to us a little bit about the one aspect of cosmetic breast surgery that we really haven't identified at all yet, and that's the whole matter of reconstructive surgery. We have some very famous recent examples of women who have had mastectomies, Angelina Jolie being perhaps the best known recently, a double mastectomy, and then reconstructive surgery. What is that procedure like, Dr. Rai? Walk us through it, please.
Well, reconstructive surgery is one where they have either a one-stage or a two-stage procedure. There are a few plastic surgeons who basically spend time and specialize in that field and work with a team of general surgeons who are involved. That means one surgeon takes the segment or the cancer out, and the reconstructive surgeon participates at the same time, which is newer technology today. Where they have the other plastic surgeon coming in and doing the reconstruction at the same time, either using an implant or using their own hormonal tissue that they have, the biological tissue, to reconstruct the breast at that time.
So it's a simultaneous exercise, Dr. Rai, where the cancer is removed and then the reconstruction begins almost immediately?
Sometimes that's one option, and the other option is to have the cancer treated first and then come back and have the reconstruction done, because you have used what is called tissue expanders to stretch the skin out so that it's in the right shape and position, and delay the surgery to do the implant replacement at a later time when the tissue has been stretched out. That's what we call using tissue expanders. It's a very complex field to discuss in a few minutes.
Of course.
It's a two-stage. What happens is when a patient comes with a diagnosis of breast cancer, they are given the options with discussion with their oncology surgeon, that is the general surgeon who does the mastectomy, and that surgeon would be discussing it with his respective plastic surgeon, the type of reconstructions they are planning. All this is done ahead of time.
Right.
With the patient's involvement. That patient may decide that I do not want to have any tissue reconstruction done, I just want an implant reconstruction, so they assess the situation and say, yes, you are a good candidate for that. So they will decide, okay, we're going to do both the procedures at the same time. So the two surgeons arrange their program in the hospital. The one surgeon does the mastectomy and the second surgeon does the reconstruction at the same time. If they feel that the cancer excision is more aggressive and they're not sure what they have done, they will say, we're going to delay your surgery to a later time.
Right.
So they'll do the mastectomy first and then rebook the patient for the reconstruction later. So that all decisions are made during the course of their consultation. So really it's a complex discussion all in a short time. It's hard to explain the whole
you're doing a fantastic job. For example, I was completely unaware of the fact that I thought the only option was you had the removal of the cancer, the mastectomy, followed sometime later by reconstruction. I was completely unaware of the fact that it's simultaneous in some instances.
We are trying to do more simultaneous care to avoid the patients having a significant deformity and image issue that they are not reconstructed, but some patients may elect to do that, or maybe the cancer is quite aggressive and you have to delay the surgery because they may need chemo treatment
Sure.
and radiation treatment and then consider the reconstruction. But at the present time, we have some dedicated plastic surgeons who only like to do this, and so they plan that with a particular general surgeon together, and so it's like a team approach to take care of breast cancer cases.
Dr. Rai, how many women, a rough percentage would choose not to go the reconstruction route? They're happy to have the cancer removed, and they'll live with whatever the aftermath of that is, as they sort of play the cards they're dealt, if you know what I mean.
Well, most of the time the education level is quite high, and the internet is there available, and they see pictures on the website, etc., of reconstructions done, and I would say a very high percentage of them would want to look close to normal if they can, and so I would say that I very rarely, unless unless the patient is extremely unhealthy and in the later part of life and, much later, and reconstruction is not an issue, so they would just have a mastectomy and live that way.
Right.
Those numbers are pretty low. But I think with the present, in today's world, the education is quite advanced and people are very aware and they do come and get a consultation and make a decision on their own. But out of every 100 you see, I'm sure more than 80 would consider doing surgery and having the reconstruction.
So it's in 2015, those are the numbers, and that's the way things work these days.
Yeah, I think the numbers are, if they can have a reconstruction, they would proceed with it. Very few of them would refuse that. But in the past, it was different. They had the choice, and information wasn't very much available.
Right.
And so many of them did not have reconstructions done. But in today's world, yes, they're all looking into trying to look as normal as possible.
Well, Doctor, the name of this program is BoomerLife, and our listeners here at CIL 650 are decidedly of the boomer vintage.
Yes.
So this question is specifically aimed at us.
Yes.
Is there a particular age cutoff where some of these procedures are just no longer viable, or is that also ancient history?
I think it's all health-related. Depending if a patient is healthy, very fit. I mean, if you look at boomers, some of them in the 70s are, very active.
Sure.
So I think you cannot say no. I mean, our lifespans are longer. Many are living up to 100. So we have to reassess our situations to decide, the outcome of what they really want. If a person is even in their 50s, not healthy, has got issues and has cardiac issues and other illnesses that they have, and very uncontrolled disease processes, I mean, those are not good candidates because they know very well their lifespan is kind of limited because of the illnesses that they have. So
Exactly, right.
I think if in today's world when people are very healthy, very fit, I think you have to give the option to them whether they want to have some form of rejuvenative surgery or not, or maybe just look better. As a matter of fact, everybody wants to look better.
Of course.
Come and see you. So that's what it is.
So the word, you come back to the word rejuvenation, Dr. Rai.
Yeah.
And so talk to us about the options, the surgical options for rejuvenation. What possibilities are there?
Well, we have, when the boomer comes in there, and let's say in their 50s or 60s, getting down more like into the 60s, they are concerned about their skin, they're concerned about their appearances. Some of them have the face sagging a bit, and they want to make themselves more youthful. And men may have larger breasts on their chest, and it bothers them. They want to contour that area. So there are two aspects to this improvement process. One is surgical, and one is non-surgical. And the surgical method is one where you're combining eyelid facelift surgery with chest liposuction, tummy tucks, etc., to get them the goal.
Right.
And the others are just saying, this doesn't bother me, it's my face, and I think I look okay, but my wrinkles are bothering me. So we combine non-surgical techniques like fillers and Botox and skincare to improve their facial appearance, and that's what they want. And so that's feasible too.
So I would imagine in some cases, perhaps not many, but in some cases, a patient would approach you expecting a surgical procedure that you reply, well, no, probably in your case, maybe some Botox would be the better approach. And that, I would imagine, would be something of a relief to that person, yes?
Yeah, it would be a relief to them, but many of them come in, they already have predetermined what their issues are, and we look at them and say, I think your eyebrows are a bit low, you got wrinkles on the corner, and that can be improved with Botox and fillers as one option, which means you have to repeat it a couple of times a year. And the other option is to do a brow lift. It's an operation to raise your brow up. And some may elect to say, yes, I like the surgical part, I want to go through that. The
Right.
other one to say, I don't want surgery, I just rather do this and come back every 4 months, and my lifestyle is the same. I can go to work. I don't have to lose time, things like that.
Right. So again, it's almost you pick one type of option. Either I'll do the Botox 2 or 3 times a year, or I'll have the single surgical procedure, and it's over and done with.
Yeah, even with surgical procedure over and done with, they do come back because they may need some sort of rejuvenative process because the brow lift would have been corrected. The eyebrows are high, but then they still have some wrinkles. They want to fix that with some lesser dose of Botox or things like that. Yeah.
Are most of these procedures that we're talking about, Dr. Rai, done a fairly short term in terms of time in the operating room?
Yeah, I mean, the brow lift could take anywhere from 2 hours to 3 hours, depending on what you're doing, or it could be faster. depending on the issue, what they present with. Whereas Botox and fillers are fairly quick. They don't take long, maybe about 10 minutes or so, or 15 minutes the most to process the whole thing and improve their facial appearance by injectables and fillers.
All right. Now, what about a more involved procedure, for example, like breast augmentation? Is that still a day surgery procedure?
It is a day surgery procedure, but it could take anywhere from an hour and a half, sometimes 2 hours. But the patient is usually there an average of about 3.5 to 4 hours to make sure it's all settled and comfortable before they go home. Yeah, it's a day procedure. They do go home the same day.
Right. And what sort of follow-up is pretty standard with these sorts of procedures, Dr. Rai?
Well, we follow them up very closely. We see them in a week, and then I see them in a month, 3 months, 6 months, and a year. So we just follow them up, and they build a relationship with you to assess how tissue is settling down, how the outcome is, what is not, what expectations you had out of the outcome, what the problems were. Sometimes they may have issues of hardening on one side called capsular contracture. We have to address that. So the follow-up is necessary to see that you have got a good outcome with a long-term follow-up.
And I don't imagine there's much difficulty to convince these people to make sure that they attend their follow-up sessions in a timely fashion.
Oh, yeah, they do. They do come. They are as much concerned themselves as they are, as you are. So they are happy to see you every time that they come in to address any issues. That's, oh, you look great, you don't need any more.
Sure.
Okay, but I still tell them, come back, see me in 6 months or so, and reassess them, see what's happening. Yeah.
Dr. Raya, I'm curious about guys, because a lot of the surgical procedures that we've talked about here would seem to me to be referring to, well, obviously breast augmentation, etc., is a female-only kind of thing, but it strikes me, at least at the surface, that a lot of these surgical procedures that we're talking about are sought after mostly by women. Now, you've mentioned men in one context.
Yes.
What other popular procedures are there that men participate in actively?
Men are very involved with facial rejuvenative aspects. They come in as well with Botox and fillers, and they also have eyelid surgery and facelifts and brow lifts if they're necessary, and particularly the chest and abdomen. They come for liposuction, or they may come for cool sculpting to tighten reduce the fat non-surgically. So it's not depending on how fit they are. They come in for those. Those are the common procedures they come in for. The chest, having a larger breasted chest, or
Sure.
or the tummy that has undergone weight loss, or they found that they got a little belly they want to fix. So we do, if they are not candidates for surgery, we recommend cool sculpting as a complement to liposuction, or a combination of both, depending on what the situation is.
So the times are a-changin', aren't they? If that many men are requesting that multiplicity of procedures.
Yes, they are. They are. As a matter of fact, the number of men have come up quite high in levels. They want to look good in this present world, and they are very competitive, and now we're living longer. We are fit. The secret is you're looking. We're seeing a lot of patients a lot of people that not only are wanting to look good, they also are looking after their lifestyles. And I think the best outcomes are people who look after themselves in their lifestyles, eating right and sleeping right, exercising right, and complementing that with skincare, surgery, etc.
Our guest talking about cosmetic surgery on this episode of Boomer Life is the surgical director at FalseCreek Healthcare Center. It's a real pleasure to have Dr. Kimit Rai on the program today. Lots more still ahead. Stay with us. We'll be right back after this.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650.